Hi, my name is Nazneen. I'm a physical therapist specializing in the rehabilitation of the pelvis in New York City. I work out of Body Harmony Physical Therapy in downtown Manhattan. The pelvic floor is a broad term to include the bony pelvis, the external genitalia, the perineum, and the pelvic muscles, the ligaments, nerves, and the blood supply of the pelvic floor. The three main functions of the pelvic floor include sphincteric, to keep us continent, both bladder and bowel, sexual pleasure, and supportive to our pelvic organs. It helps to aid in pregnancy, labor, and delivery. People come for pelvic floor PT for a variety of reasons, which includes chronic pelvic pain, pain with sitting, endometriosis, pain with sex, urinary incontinence, bowel incontinence, constipation, prenatal, postpartum. We see both men and women, even children who have voiding issues or constipation. Physical therapists are experts in the musculoskeletal system, and the pelvic floor is part of the musculoskeletal system. So, the long term goals of pelvic PT are to restore and balance pelvic activity, thereby improving pelvic function and quality of life. And these goals would include decreasing pain, improving scar mobility, improving sexual function, and bladder and bowel function. We individualize treatments based on your symptoms and your diagnosis so that you can achieve the best possible outcomes with physical therapy. I had a patient a couple of years ago. She was postpartum. She had pelvic organ prolapse, grade 3, and she was had complete urinary incontinence. Couldn't hold her urinary leakage. She was a little hesitant, did not think PT would be able to help her. And we were able to reduce with physical therapy, working on stretching and strengthening the muscle. We were able to get her completely continent within 3 months and also help reduce the prolapse a little bit by strengthening the pelvic floor muscles surrounding it. So if you have any symptoms where, for example, with urinary like urgency during the day, you're urinating more than one time every hour, like if you're urinating one time every hour, or if you're, coming home and what we often refer to as key and lock syndrome, when you're opening the door to your apartment and you need to pee and you're not able to hold your pee and pee on yourself, or when you're laughing, sneezing, running, and you're not able to hold your urine. Those are all reasons to come in for PT, because what usually happens is that your pelvic floor muscles have become shortened or spasmed. They're weak. So as pelvic floor PTs, we work on lengthening those muscles, strengthening them so that you can be continent. No one needs to be incontinent. And wear a diaper or wear a panty line or a pad at any given time, whether it's, irrespective of your age. Most people don't know there's help out there and that physical therapy can help with pelvic floor problems that you might be facing. That's very common. Most people don't even know that they have pelvic floor muscles. So that's the most common theme that we hear from patients, that, oh, I didn't know a physical therapist can help with pelvic pain, or with pain with sex, or with constipation or urinary incontinence. So we educate patients a lot about, education is a big part of what we do. We educate them about their pelvis, the muscles, how they function. So we want functional outcomes, and we want people to be able to go through their life without being in pain or having any other symptoms. Pelvic floor education, knowing that you have the muscles and how they operate, are the main education bit of pelvic floor PTs. My favorite part is when my patients have an aha moment, like we're working with them and then the switch happens when they realize that, oh wow, we're getting better, and we're, pelvic floor PT or physical therapy of any sort is helping them. I feel like physical therapy, most people don't realize how effective and important physical therapy is. And that we can, we don't just treat necks and backs and shoulders and hips and knees. We look at the body as a whole. And if you have a dysfunction in one place of your body, in one joint or muscle, it can translate and travel into other joints and muscles. It's a whole body experience. I think one of the most important thing is that patients should ask questions of their therapist, of any of their healthcare providers, to ask questions and to trust their body. And if they feel like something's not functioning properly or not working properly, that they should voice it and not just take what anyone has to say for face value, because we know our bodies best. If something is suddenly not working the way we're used to it working, clearly there's something going on within that needs to be addressed.